Hello, I'm Dori Kleesis, and I'm with Dr. Ken Davis, the CEO and President of the Mount Sinai Health System. Today, he was on a panel here at the Aspen Ideas Festival entitled, "What Will It Take to Make Drugs More Affordable?" So I'd like to start by asking him, how do we improve our drug ecosystem?
Well, we want two things. We want more innovative drugs and we want more affordable drugs. So let's talk about ways we could do both. And innovative drugs would be drugs that the country really needs to decrease their healthcare costs. We need drugs that go after the most chronic diseases, the diseases that cost the country the most money. We need to address questions like, can we develop a non-addictive pain reliever that'll take the place of opiates because of the opioid epidemic? We need to ask, is there anything we can do to decrease the consequences of type 2 diabetes or delay the onset of type 2 diabetes? What are we doing about Alzheimer's disease to delay its onset? These and a few others are major diseases that we don't have the drugs for. And what we have to ask ourselves is, what can we do to change our patent law and our incentives so that the drug companies are going to give us the drugs that are going to be most needed for healthcare rather than might provide for them the most immediate return on investment.
So take the patent laws. You have some ideas on that. How do we change them for innovation?
We've already extended a period of market exclusivity, regardless of patent life, for a number of conditions. For orphan diseases, we have that Orphan Drug Act, which extended a period of exclusivity. It encouraged companies to go ahead and develop drugs in areas they never did. In the Affordable Care Act, we put in 12 years of market exclusivity for any protein or antibody. So companies developing all proteins and antibodies. What we need to ask ourselves is, well, what else does this country really need? And to bend the cost curve, we need to do something about obesity, type 2 diabetes, and Alzheimer's disease and other chronic diseases like that. We need to ask, do we give increased market exclusivity, increased patent life for those diseases so that we can incentivize companies to go ahead and develop drugs in that area? At the same time, we have to take a hard look at what we are incentivizing. We incentivize too many Me Too compounds that may have a different synthesis or a different chemical, but the fact is they're not really innovations. And we call them innovations by the way patent law is written today, because patent law looks at semiconductors the same way it looks at drugs. And looking at drugs and semiconductors and things like that as equivalent just isn't the case.